the minimally invasive procedures that we can provide at the Sydney Adventist Hospital cath labs have revolutionised what we can offer here for cardiac patients. Historically, they've been open heart surgery and the recovery has been particularly long. With the initial advent of coronary artery balloon angioplasty and stenting, which is now a few decades old, they were able to open up their arteries without the need for bypass. More recently, we can now offer new valves without having to actually open up their chest. The Sydney Adventist Hospital has 3 cardiac catheterisation laboratories, and they're the cutting edge of technologies. There's one that's particularly new and is less than 12 months old. In those laboratories, we can offer a range of technologies for coronary artery angiography and angioplasty, which is stenting, through to balloon aortic valvuloplasty, through to TAVI procedures. There's also a range of implantation of pacemakers and devices, along with ablation studies. The technology itself depends on X-ray imaging and fluoroscopy. So the patient that comes along to our cardiac catheterisation laboratories for an intervention will expect to arrive in a large, clean laboratory full of quite technical equipment. They'll be draped in a very clean, sterile conditions, and they potentially could be given some sedation or even general anaesthesia. There'll be a team of nursing staff along with the interventional cardiologist that they should be familiar with beforehand. The catheters that are engaged to the coronary arteries will have dye placed in them, and this can be visualised on X-rays at different angles. And indeed, the sedated patient may still be awake enough to actually visualise blood and contrast going down their arteries. There, they can actually find whether there are specific narrowings in the arteries. And through that same catheter-based approach, we can pass small wires and balloons to open up the narrowings and stents to place and keep the artery well and truly patent. Once the procedure is complete, the catheters will be removed and the small incision that's made either in the wrist or the groin is sealed either with a stitch or with a band that actually seals the hole for a period of a few hours. The patient will be then taken to our recovery area where they'll be closely monitored for a few hours. If all they're having is a diagnostic procedure, they tend to go home the same day. If, however, they've had an intervention, whether it be an ablation or a stent or a device in place, then they do tend to stay overnight in our coronary care units, which is situated just next door. Both units are very well equipped with highly trained cardiac nurses, and they can be very much at ease that they'll be well looked after the whole period they're here. They are, more importantly, they are back performing their daily activities, their day-to-day existence without any functional impairment within a week. And that is clearly a great improvement from open heart surgery, which may take months before they're back in work or performing their daily duties. As an interventional cardiologist in particular, we can identify patients that are particularly and acutely quite unwell. And the greatest pride that we have is to offer a service that can change their outcome within hours. When someone presents with a heart attack, we can open up their artery, and within an hour they're out of danger and their future is looking particularly bright compared to how it was an hour or two previously. Thank you.